Hey there. Chances are you've seen Naproxen on a pharmacy shelf, or hey, maybe you even have some in your medicine cabinet right now. It is one of the most common pain relievers out there. But here's the thing, just because it's common doesn't mean it's simple. To use it safely, you really need to understand what you're working with, and that's exactly what we're going to break down today.
So, here's our game plan. We're going to start with the basics. What even is naproxen? Then we'll cover how to take it the right way, walk through the side effects from the mild to the really serious ones, and wrap up with the absolute must-know signs that mean you need to get help and the one key takeaway I want you to remember.
All right, let's dive right in. First things first, what exactly is this medication that so many of us reach for when we're in pain?
Okay, so naproxen belongs to a class of drugs called NSAIDs. That's a mouthful, but it just stands for non-steroidal anti-inflammatory drugs. And that name tells you exactly what it does. It fights inflammation in your body. You can just grab it off the shelf in lower doses, but your doctor can also write you a prescription for higher strengths if you need something a bit stronger.
So, why do people use it? Well, it's a real workhorse of a medicine. It's fantastic for everyday aches and pains, bringing down swelling after an injury, and even knocking out a fever. But it also plays a huge role in managing long-term conditions like arthritis and those incredibly painful gout attacks.
Now, while naproxen is the actual name of the drug, you've probably seen it on the pharmacy shelf with a different name on the box. The most common ones you'll run into are Naproxen and Napoleon. It's the exact same active ingredient, just a different brand name.
Knowing what it's for, that's step one. Step two is just as critical, knowing how to take it correctly. Seriously, following these simple steps can make a huge difference, both in how well it works and in helping you avoid some of the annoying side effects.
The instructions are pretty straightforward. The first two are simple. You take the pill by mouth, and you wash it down with a full glass of water. But that third point is the pro tip. If you find that naproxen is a little rough on your stomach, taking it with some food can act like a buffer and make it way easier on your digestive system.
That tip about stomach upset is the perfect lead-in to our next topic, side effects. Like any medication out there, naproxen has them. The good news is, most are pretty mild, but just knowing what to look out for is a huge part of using it safely.
By far, and I mean hands down, the number one side effect people report is an upset stomach, and that connects right back to what we just talked about. That uncomfortable feeling is exactly why taking it with food is such a common piece of advice from doctors and pharmacists.
Now, beyond the stomach stuff, there are a few other things you might feel, though they aren't quite as common. We're talking about things like feeling a bit dizzy or sleepy, getting a headache, or dealing with some nausea, heartburn, diarrhea, or even vomiting. If any of these get really bad or just won't go away, that's your cue to check in with your pharmacist.
Okay, we need to shift gears for a minute and talk about something a lot more serious. Naproxen, and actually all NSAIDs, come with something called a black box warning from the FDA. You need to know that this is the strongest possible warning they issue, and it's reserved for risks that could be life-threatening. This right here is the official language from the warning. It sounds pretty intense, right? It points to two major risks. The first, serious cardiovascular thrombotic events, basically means an increased risk of blood clots that could lead to a heart attack or a stroke. The second, serious gastrointestinal bleeding, means exactly what it sounds like. Dangerous bleeding, ulcers, or even a tear in the lining of your stomach or intestines. So this is the crucial part. This medicine is not for everyone. There are some situations where you absolutely should not take it. If you've ever had asthma or an allergic reaction to aspirin or another NSAID, you need to steer clear. It's also a definite no-go for anyone who is about to have or has just had coronary artery bypass surgery, which you might know as KABG.
So knowing about these big warnings is one thing, but what does that actually mean for you day to day? What are the specific red flags you need to be watching for that should make you pick up the phone and call your doctor immediately?
This brings us to what might be the most critical part of this entire explainer. We're going to walk through the urgent signs you simply cannot ignore. If you experience any of these while taking naproxen, it is absolutely time to seek medical help right away. First up, let's talk about signs of an allergic reaction. This could look like a skin rash or some really intense itching. You might also notice swelling, especially in your face, tongue, or throat. And a feeling of tightness in your chest is another really serious warning sign.
Next, the signs of internal bleeding, which tie directly back to that black box warning. You need to be on the lookout for vomiting blood. And specifically, if it looks like coffee grounds, that's a classic sign. Also, coughing up blood, or seeing blood in your urine or in your stool, those are all immediate red flags.
Naproxen can also have an impact on your kidneys. So, signs of kidney trouble would include a really noticeable change in how much or how little you're urinating. Again, seeing blood in your urine is a problem. And a large, sudden weight gain can be a sign that your body is holding on to fluid, which can point to a kidney issue.
High potassium levels are another serious possibility. Now, you won't know your potassium is high, but you might feel it. It could feel like your heartbeat is irregular, just off. Or it could show up as feeling confused, strangely weak, or really lightheaded and dizzy.
And finally, we have the urgent neurological signs. Look, these are very similar to stroke symptoms, and they require an immediate emergency response. We're talking weakness on just one side of your body, sudden trouble speaking or thinking clearly, losing your balance, any drooping on one side of your face, or suddenly blurred vision. These are not wait-and-see symptoms. This is 911 time.
Whew! Okay, we have covered a lot of ground here, from the simple basics all the way to some really serious warnings. So after all of that information, what's the one thing, the single most important thing you should take away from all this?
Here it is. It's this simple. You should always talk to your pharmacist or your doctor before you start taking any new medication or before you change how you're taking something. And yes, that absolutely includes over-the-counter drugs like Naproxen. They're the ones who can look at your personal health history and help you make the safest choice for you.
And that leaves us with one last question for you to think about. Knowing that even a common, easy-to-get medicine like Naproxen carries these potential risks, how does that change the way you look at the other things in your medicine cabinet? It's a really powerful reminder that over-the-counter definitely doesn't mean risk-free.
Thank you so much for joining us for this explainer. Stay safe, and remember to always be an active partner in your own healthcare. Now please keep the following standard disclaimer in mind. This information is provided for public education only and is not intended to substitute for a manufacturer's directions or consultation with a licensed pharmacist or healthcare professional. All medication, including those available over the counter, can be harmful if not used as directed, and taking more than one medication could result in harmful drug interactions. Please consult a licensed pharmacist or healthcare professional before taking any medication or changing an already approved or prescribed medication plan.